In this session, we will discuss the art of caring in a technology-laden environment. At the end of this session, you will be able to identify the potential disruption of technology to the therapeutic nurse-patient relationship. Nursing is hard work, and depending on the site of practice, it can be both physically and mentally taxing. Nurses are masters at multitasking, that is, performing several caring functions simultaneously during a patient encounter. Some nursing interventions are readily apparent and easily described, such as collecting vital signs, data, and changing dressings, while others are less visible yet equally important, such as interpreting vital signs data, generating knowledge about the patient's situation, and then using that knowledge to inform practice. Equally invisible, yet important to the therapeutic caring environment, are the little things that nurses say, project, and do in the caring episode. Caring functions such as therapeutic communication, listening, touch, and mindfulness are an integral part of nursing science, as they also help patients to maintain, enhance, or restore their health. With new technologies such as smart pumps, barcode administration systems, electronic health records, and smartphones being introduced into our practice environments, they are designed to increase efficiency, promote safety, and streamline the work of nursing. We need to ask, to what extent do these technologies disrupt the nurse-patient caring encounter? How can we continue to care effectively for our patients and promote a healing environment while incorporating the advantages and efficiencies that technologies provide? Caring functions such as therapeutic communication, listening, touch, and mindfulness are an integral part of nursing science, as they also help patients to maintain, enhance, and restore their health. While new technologies such as smart pumps, barcode medication administration systems, electronic health records, and smartphones being introduced into the practice environments, they are designed, again, to increase efficiency, promote safety, and streamline nursing work. To the overwhelming presence of technology at the clinical bedside has the power to become the strongest reference points that nurses use to inform, direct, interpret, evaluate, and understand nursing care. We must remember that technology, however, does not take into consideration the specific symptom presentation unique to the person experiencing the illness. Technology's use is not meant to replace the person-to-person interaction that is essential in any nurse-patient encounter. We also need to think carefully about the potential barriers to active listening that technology might present. For example, do you push the workstation into the room, focus your attention on the computer screen, and talk at the screen as you clicked on the drop-down menus to document the patient encounter? Does the workstation create a barrier between you, the patient, and the patient's family? Is your assessment of the patient's current situation colored by the objective representation of the person created by the monitor technologies present in the room? Let us all strive for beneficial practice that compensates for the potential disruptions to the therapeutic nurse-patient relationship that our use of technology is producing. Presence is the act of being there and being with our patients, fully focusing on their needs. Presence is an interpersonal process that is characterized by sensitivity, holism, intimacy, vulnerability, and adaptation to unique circumstances. Penk and Snyder in 2010 defined 3 types of presence: physical presence, full presence, and transcendent presence. A nurse who is physically present is largely competent in carrying out care, efficient with interventions, but inattentive to communication and nonverbal cues projected by the patient and family. When present, a nurse will greet the patient by name, communicate appropriately with the patient, and pay attention to what is being said and not said during the encounter. When nurses practice transcendent presence, They will first center themselves, clearing their mind of all potential distractions, and then use the patient's name and gentle touch to convey interest and responsiveness while carrying out the necessary physical interventions. The simplest and perhaps most effective strategy we can use to help us be fully present to our patients is to pause, to take a few deep breaths to calm ourselves and clear the clutter from our minds before we address each patient. It also helps to repeat the patient's name silently a time or two before we enter the room. This practice, known as centering, enables the nurse to be available with the whole self, be open to the personal and care of needs of the patient. When we are with a patient, we need to be certain that our mind is fully engaged in the interaction with this patient at the moment. We must be fully attentive to the patient, be both physically and mentally present, meet the patient where he or she is emotionally, listen actively to what the patient is saying, focus on nonverbal cues the patient is projecting, touch the patient gently and reassuringly, and demonstrate acceptance. Nursing practice relies on information and communication technologies that receives inputs from nurses as well as all of the patient care technologies. Computers, handheld devices, monitors, and other healthcare technologies are essential tools for nurses. Therefore, the nurse must have the ability to implement, monitor, and evaluate all of this equipment based on its inputs and outputs. The increased demands on the nurse make it easy to lose sight of the patient amid all of the technologies. Nurses must look at monitors, devices, and other gadgets to receive information. Oftentimes, it is easy to forget that the patient is at the core of our care. We hope that this brief overview of caring presence prompts you to be more mindful of your practice and that you too will commit to employing strategies that enhance your caring presence in all patient encounters. We do not want our patients to feel that we are more focused on the machines that they are connected to or the workstations that we bring with us to the patient encounter. Yes, technology is great and it does help us collect meaningful data and generate knowledge about our patient situations, but equally important is the need to collect the human-to-human data that becomes available only when we step away from technology and interact authentically with our patients.